Hi, I'm Jasmine Arthur. I'm here today to tell you all about cerebral palsy. Did you know that globally over 17 million people have cerebral palsy? This is according to the Cerebral Palsy Foundation. Cerebral palsy is a disease that is not always talked about, and many people do not even know what it is. That is why I'm here today. I was diagnosed with a mild case of cerebral palsy when I was 5 months old. Although I've lived with the disease my whole life, it is very mild and many people have it more severe. This is why they are not always able to advocate for their disease and why it's important for me to tell you all about it today. Cerebral palsy is a non-progressive neurological disease that affects the body's movements and fine motor skills. It usually occurs before or right after birth. It is a disease that is not talked about often enough, and many people have heard about it but don't know there are different types of cerebral palsy and many ways to treat it. I will now explain the different types of cerebral palsy along with how it occurs or how a person is diagnosed with it and the many ways to treat cerebral palsy. I would like to begin by educating you on the different types of cerebral palsy with the help of medical experts from the Cerebral Palsy Foundation. You may not know this, but there are many different types of cerebral palsy. One of the types of cerebral palsy is quadriplegia. Quadriplegia is the most severe type of cerebral palsy, and this is where both arms and legs are affected, and the muscles of the trunk, face, and mouth are also affected. This is according to the Cerebral Palsy Foundation. Hemiplegia is another type of cerebral palsy. It is less severe than the first type I mentioned. Hemiplegia occurs when one side of the body, both the arm and the leg, are affected. This is according to the Cerebral Palsy Foundation. Lastly, diplegia is a type of cerebral palsy where both legs are affected and the arms may be affected to a lesser extent. This is according to the Cerebral Palsy Foundation. This is the most mild type of CP, and this is the type that I have been diagnosed with. Now that you understand the different types of cerebral palsy, I will educate you all on the diagnosis of the disease. Diagnosis of the neurological disease, cerebral palsy, usually occurs before or just after birth. Many children are diagnosed with CP right after they are born because the signs are immediate. This is because children will struggle to breathe. Doctors will also notice that their feet are turning in towards each other. Doctors can also tell during pregnancy through ultrasounds or through genetic testing before a baby is born. When I was born, I could not breathe. Doctors believe this is when my brain injury occurred because of lack of oxygen. Although I was not diagnosed until several months later after my pediatric doctor noticed that something was off with my development. Lastly, the treatment of cerebral palsy is very important because without the help of surgery and physical therapy, there would be no way for any CP patient to improve their quality of life. There are quite a few ways to treat cerebral palsy. Cerebral palsy can be treated with surgery like a selective dorsal rhizotomy. A dorsal rhizotomy is a surgical treatment that allows for a decrease in spasticity in patients with cerebral palsy. This is according to an academic journal. This type of surgery works well for children affected with CP and can lessen the spasticity that they experience because of the disease. While a spinal rhizotomy mainly helps children who are affected by CP, physical therapy works for adults and children alike. It is the most common type of treatment for cerebral palsy, and some of the benefits of physical therapy include a more normal quality of movement and an emphasis on functional activities. This is according to an academic journal. Occupational therapy is also an option for anyone who has CP. This type of therapy helps patients by showing them easier ways to do things in their day-to-day lives. I have been in PT my entire life and has helped the tightness of my muscles drastically throughout the years. I also underwent a spinal rhizotomy when I was 3 years old. All of these treatment options are credible and can help people with cerebral palsy immensely. To conclude, cerebral palsy is a neurological disease that affects the way a person moves. There are many types of cerebral palsy: quadriplegia, hemiplegia, and diplegia. This disease is usually diagnosed after a person is born, although with testing, cerebral palsy can be diagnosed during pregnancy. Physical therapy and surgical procedures can also help improve a person with cerebral palsy's quality of life. Cerebral palsy affects many people around the world, and I believe that it's very important to educate everyone about the disease. Thank you.